Good morning, all. It's a pleasure to be with you all. I would like to extend my greetings to Dr. Adeiza, my colleagues, panelists, Dr. Marie Mazur, and Dr. Patrick Tippoo. It's a pleasure to be with you here and share the Brazilian experience during this last year and talk about the expectations and future challenges in terms of logistics and delivery of vaccines to face this COVID-19 pandemic. Let me talk to you about the specific challenges our country faces. Our population is 210 million inhabitants approximately. If we cut the population between those over 18, we're talking about 170 million inhabitants. The territories is 8.5 million square kilometers. So we are the fifth largest country in the world. The population is centralized in large cities, but the challenge is to reach the whole population, the whole Brazilian population, so we can immunize them with a COVID-19 vaccine. Let me give you a snapshot of the pandemic in Brazil. Unfortunately, we now have 440,000 deaths, which is in percentage 0.3% of our population. We are stabilized now with a trend down in terms of number of cases and number of deaths, but the number of deaths is still very high per day. 2,000 deaths per day, unfortunately. So this demonstrates the importance of the vaccine and the challenge in terms of logistics for our country. We use 3 vaccines: Sinovac from China, AstraZeneca, the vaccine is also made in China, and then Pfizer, we import the doses from the US. Each has specific storage capabilities. Pfizer is the most difficult. We have to storage that vaccine at temperatures below 70 degrees centigrade. And so we need to have freezers and ultra freezers. We did not have that in our infrastructure. So you have an idea. Annually, Brazil distributes about 300 million doses for more than 47 different diseases to immunize the Brazilian population. With the pandemic, we have stressed our infrastructure, doubling the amount of vaccines so that we can continue immunizing our population. We are still continuing with vaccination campaigns, the ones we always had, but now we're stressing our infrastructure, doubling our capacity to immunize. Just so you have an idea how we established this cold chain, we have a national central under the federal government. This national center stores all the vaccines and distributes it to the 27 state centrals. So we have the federal government, state governments, and municipal governments. So the federal government distributes it to 27 centers in the states, and then that is distributed to 273 distributing centers in the different regions and municipalities. And from there, then it's taken to the 3,342 municipalities. So we have more than 5,500 municipalities in Brazil. So that's the large challenge. We have had PAHO support to give infrastructure to the country. We received some ultra freezers bought with the support of PAHO and their partnership so that the country and the municipalities municipalities have adequate freezers to store these vaccines. Pfizer vaccine, for example, is only used in large cities because we do not have enough infrastructure to store those vaccines in all municipalities. I am going to show you a slide to show you a specific challenge that we have is how to immunize the indigenous communities. Here in the map, we have 34 Indian districts which have to be immunized. When we created the national immunization plan, we gave priority to indigenous communities. They were the first to be vaccinated in Brazil. And that gave us an additional challenge to reach all the villages to do immunization. Here on the map, we have the 34 districts where the indigenous communities are, where we had to go at the beginning of this year and the end of last year. Here we have some images of the vaccination of these indigenous communities. The 34 municipalities that we reached, we had to travel all the way to the villages, often using boats to get to them. This concludes my participation, and I am ready to discuss, to contribute. I brought those images to show you the Brazilian challenge. We have a very large territory, a very large population concentrated in urban areas, but also we have population that's disseminated throughout the territory that has to be vaccinated. That's our challenge. Thank you for the opportunity to be here with you and to discuss these logistic issues.